Welcome to the Clinical Research Podcast, bringing you the latest developments in research explained by our world-leading clinicians, academics and scientists based in Nottingham. When a child or young person comes to hospital in an emergency and mental health issues are clearly involved, how do we know how we can help them best? Health professionals can be unsure what to look for, what to do about what they see, and how to judge how much they're helping the situation. Dr. Joseph Manning, a clinical academic nurse at Nottingham University Hospital's NHS Trust and an NIHR lecturer at the University of Nottingham, is leading the SAPHE study, which is spelt with a PH rather than an F, which is researching how to make treatment of children and young people with mental health issues more effective and consistent. It's doing that by working with those children and young people.
You know, inpatient care is very much geared up to physical health problems. You know, so if you've got a sepsis or if you've got a broken limb, you know, we're really great at dealing with that. We've got all of the processes and systems in place. But for people in mental health crisis, there are some really challenging things around, you know, their thoughts and feelings and behaviours that oftentimes we you know, and I'm a children's nurse, so I also relate to it that we don't feel very well equipped to deal with them, and I suppose that's the purpose of this pathway that we're trying to develop, is that we've identified the risk and we've tried to quantify the level of risk for these young people, and then it's about saying, okay, well, based on that, what can we do about it? What's the evidence-based interventions that we can implement as nurses and other health professionals to try and help support and enhance the care experience for these young people, but also their outcomes and make them feel safer.
That sounds like quite a challenge, trying to essentially turn something that's very kind of qualitative and almost like touchy-feely into numbers. That must have been quite a challenge, or is?
Yeah, I mean, I think I work across methods, so you know, and I think it's really important that we understand the rich qualitative lived experiences of people, and this whole program of work has really been centered around that preliminary work that we did, where we asked young people and children as young as 10, what their care pathways were like, what their experiences of being an inpatient on a children's ward. And from those rich insights that we gleaned from those interviews and from using very sort of participatory art-based approaches, visual timelining and graphic elicitation techniques, we were then able to pull out a whole raft of subsequent questions that we needed to answer, and so that was the sort of the point in this journey that really sort of expedited a whole range of other work that we've undertaken. Working in healthcare, it's an art and a science, and so we've got to understand and for my program of work, I do use mixed methods because I think that's the best way in which we can comprehend the complexity and the entirety of phenomena within healthcare.
You just described maybe some of the examples of the techniques that you used.
Yeah, so we've used a range of techniques, and I work with some really great researchers. Professor Jane Code, who's a professor of children and families nursing, and has done some really seminal work in the field around applying art-based methods into healthcare research. And so we've sort of built on some of her work and her experience and expertise in the field, and tried to use those techniques to sort of liberate the views and experiences and hear the voices of young people. Because oftentimes when it's an emotive or evocative topic, when some, you know, and I, as an adult who's relatively verbally articulate, do struggle to find the words sometimes. And so maybe using other techniques, so using imagery and asking people to draw or use art-based approaches to communicate their thoughts and feelings and experiences. We've also used photo elicitation techniques. So they've taken photos of, you know, environment or people or objects, and then use that as the focus for discussion or writing, then that can be a really useful sort of approach to, as I say, elicit the oftentimes marginalized or unheard views of children and young people.
I can maybe fairly easily see how if it's a picture, then it might work. But how would you draw out a 10-year-old looking at a photo to get something that you can then feed into the essentially ending up with the design of an app, isn't it?
Yeah, so I think it's about asking, having some level of focus with it. So it's about asking the child or young person, and certainly for the app development, we're co-creating. We're in this sort of experience-based co-design methodology, and therefore it's not so much us telling, it's about us working within that collaborative space to find some commonality, and also us developing something together. And again, that's where that method of visual techniques works, because so for not specifically for this project, but for other studies that I've done, given children cameras to talk about their experiences and what their life is like now and what their needs are, given them that brief, and then in between the interviews, if I'm doing serial interviews with them, they take photos, and then in that interview encounter, we've printed out those photos, and then we've talked through, and it's really very much open questioning, line of questioning. What's happening here? Why have you taken this? What do you how does it feel? What do you think about that now, reflecting back on it? All of those sort of questions that may be able to elicit some deeper insights into the phenomena as experienced by that child or young person. And I think there's one size does not fit all. And, sometimes these techniques are really good and sometimes they are not. And that's why I am a key sort of advocate for a sort of a toolbox of methods. So say, if you've got visual timelining or graphic elicitation techniques where they can draw things, or, and using photography and photo elicitation methods, and also a sort of a responsive interviewing technique, and giving the young person choice. Do you want to use those? And it's absolutely fine if you don't. But I think it's about having that toolbox there so that you can get the best out of that interview encounter in a robust and methodologically rigorous way. And I think that's the thing with these approaches, is that they are embedded on it with an evidence base, and we're not just sort of plucking things out of the air and then making it up. And I think that is oftentimes the misconception with these sort of approaches as applied to health research, which is not the case.
Defend is the wrong word, but how would you kind of explain how that is robust?
Well, I think with any sort of qualitative research, whether it's interviewing or using art-based methods, then I think it's about, having rigor in your process. So being transparent around, what has informed that approach, how you've applied it, and how, certainly within the qualitative domain, that the notion of reflexivity, being critically aware of your role and your influence on that interview encounter, whether you're using those methods or not, and what impact that has on the data that you're eliciting. And then subsequently through that data analytical process, it's about being really transparent to ensure that you are credible and that there is rigor in the process, and that you have been exposed to external scrutiny. And I think, yes, we're working in different paradigms. If you're working in a more sort of quantitative way, and whether it's counting cells or looking at things under the microscope or using big data sets, there are also assumptions made within the methods in which you're employing, whether that be the methods of collecting that data or analyzing that data. And the same is within the qualitative paradigm. But I think, as researchers and as scientists, we all are aligned to the fact that we want the best quality. And from my perspective, healthcare is messy, it's complex, it's real world. We're not in a vacuum, and therefore we need to think of a whole diverse array of methods in which we can try and collect in order to understand the complexity of healthcare phenomena.
So then moving on, having collected this data, you're then in the, how do you make it of use? And then how do you feed it into the apps or the digital methodology that people are going to use?
The first phase is around actually gathering the evidence to inform the risk mitigation pathways. And we're doing a more sort of conventional rapid review of the literature, systematic review of the literature, but also going out to those people that are delivering these sort of interventions within, not within an acute pediatric care environment, but within a more sort of mental health environment, which will enable us to elicit some experts' views on what are the strategies that are best and how they evaluate the effectiveness of those strategies. In conjunction with that, we're also engaging with children and young people that may have been admitted to acute paediatric care and also been in receipt of these interventions, because I think absolutely that is key, not just understanding the effectiveness, but actually what's the impact on it and what's acceptable to these young people, knowing that, yes, these young people may be in a state of crisis, they may be perceive something to be not great when actually it was life-saving. So we need to recognize that, but that's the first phase where we're applying these methods and then drawing it down and trying to get some level of consensus around what are the priorities if we've got a whole raft of risk mitigation strategies. Then the co-design of the actual prototype will include young people, children and young people, as well as health professionals as the key stakeholders. And that will be an iterative process in developing the intervention. And in this case, it's a digital intervention where we'll also bring in the expertise of technologists and digital experts to help sort of, I suppose, guide the process, because whilst there may be some fantastic innovative ideas, the feasibility of actually translating that into something tangible in an app may not be realistic. So I think it's about applying all of those techniques, and we will be using those techniques within those workshops to try and focus ideas and thoughts and channel, you know, the experiences and views of quite a diverse group of stakeholders to come up with a prototype at the end of it, which is what we're hoping to get out at the end of the study.
When the study's done and the results are kind of there, what does that look like?
What it could be like is that we needed a more sort of integrated approach, that we need, you know, the right systems and processes in place such as this SAPHE instrument, where we can rapidly assess status of risk, whether they're going to harm themselves or whether they're going to try and end their life. And we can put in an evidence-based interventions to try and reduce the level of risk and make their care experience better. And I suppose what that may do is we may find that actually more children could be going back home as a result of having more effective care whilst they're in hospital, in this acute pediatric inpatient care part of their care pathway. Or it could be that actually when they do get to more specialist mental health services, that they are in a decreased crisis state. So I think that's where we're at the moment, and that's where we need to be aiming for, and that's how this work fits in. And my ambition for all of this work is that this will improve the experience, the outcomes and safety of care for these very vulnerable and often marginalized children and young people that are presenting in very large numbers to acute pediatric care in mental health crisis. And I think that we will not stop until we've achieved that ambition, because we know that we can do things better for not just the young people, but also for the staff. You know, nobody comes to work to do a bad job. Nobody wants to provide inferior care. And actually, there's a real appetite, not just locally, but nationally, from people that are providing acute paediatric services to children and young people to say, actually, we need to do things better, and we want to do things better, and we just need the tools and the evidence to enable us to do that better. And I think the SAPHE study will take us closer to achieving that ambition.
That's brilliant. It's a good note to end on. Thanks very much. Joseph mentioned Professor Jane Code, another of our researchers at Nottingham, and there's an interview with her coming up in an episode soon. Thanks for listening. There are links to the subjects we talked about in the show notes, and more information about research and innovation on the Nottingham University Hospital NHS Trust website, which is www.nuh.nhs.uk/research. Our email and social media links are there too. To stay up to date with the Clinical Research Podcast, find us on iTunes, Spotify, Google, or wherever you normally get your podcasts. The more shows are rated and reviewed, the easier it is for search engines to find us. So if you can subscribe and rate and review us, you'll be doing it for science.